For so many folks, as soon as they got vaccinated, they kind of just turned their brain off about coronavirus concerns.
After more than a year of being on high alert, they just stopped worrying about it because they knew that they were protected against the virus.
But now, with the Delta variant out there, medical experts are saying, really, it's time to turn that brain back on and pay attention.
I'm Maddie Gardner here with Ben Briscoe, and from now until 6 o'clock, we're going to make it really easy for you by digging into all the information you actually need to know about this Delta variant.
Like the fact that the threat of it just hit home in North Carolina in a very real way. We now know that 8 North Carolina State University baseball players have tested positive for the Delta variant. The university chancellor confirmed it in a video message on the school's website this morning. The outbreak of the cases ended the team's run in the College World Series. They were just one win away from going up for the school's first national championship title since 1983. In a video message on the school's website, the chancellor said 4 unvaccinated students and 4 vaccinated players tested positive. It's unclear if the vaccinated positive players were out of their 2-week waiting period, though, for full effectiveness.
We understand the gravity of 8 players testing positive, and the fact that this was the Delta variant, which is a variant that's come from India that's super contagious and is quickly emerging in the country as potentially another wave of infection.
In fact, just yesterday, Governor Roy Cooper warned that the Delta variant was probably on its way to our state.
We hope that people will look at this and see that this is something that is still here and it's moving through our population of unvaccinated people, and it shows we need to get our vaccines now.
The Delta variant now accounts for more than 20% of all new cases in the U.S. That's up from just 2% last month. When President Joe Biden came to North Carolina last week, he also said we need to be on guard, and getting vaccinated is the best way you can protect yourself.
That it's more easily transmittable, this Delta variant, potentially deadlier, and especially dangerous for young people. He says it's the greatest threat to our fight to beat COVID-19.
So what do we really need to know about this mutation of the virus? I went to Dr. Cynthia Snyder of Cone Health for the facts.
So we are seeing folks who are fully vaccinated getting the virus of getting COVID-19. However, it still appears to be mild disease.
And when you hear that this could soon be the dominant strain in our state and you still could get it even though you're vaccinated, some people may hear that and say, okay, well then why get vaccinated? What's the point in all of this? What's your response to them?
You know, I think some protection is better than no protection, right? We know that, and even folks who may have had COVID in the past, they're like, well, I have natural immunity. Do I need to get vaccinated? The answer is still yes.
And the vaccine may not 100% protect you from getting the virus, but it can prevent you from getting those really serious symptoms.
Yes, without a doubt. And that's the key thing, right? Nobody wants to be hospitalized.
Do you think that we'll need booster shots down the road?
You know, I feel like that's like the $1 million question. I probably get asked that a good 10 times a day. And it's hard to tell. I think every day there's new studies that are showing the durability of the vaccine.
But there's a catch. Dr. Anthony Fauci says you've got to get both doses of the vaccine for it to really protect you against Delta. But what if you got the Johnson & Johnson shot? That only comes with 1 dose of the vaccine. How protected are you then? It turns out that depends on who you ask. Dr. Angela Rasmussen is an infectious disease expert at Georgetown University. She tweeted that she initially got Johnson & Johnson, but later followed it up with a Pfizer shot. She says, we know that 2-dose regimens of mRNA or AstraZeneca are highly protective against the Delta variant, but a single dose is not. Public Health England released a study last month illustrating this. It shows 2 doses of Pfizer protected against systematic COVID 88% of the time. 2 doses of AstraZeneca protected 60% of the time, and a single dose of either cut effectiveness to 33%. Dr. Carla Robertson's a North Carolina physician who says the assumption there is Johnson & Johnson is a viral vector vaccine, just like AstraZeneca.
The assumption is that it very likely will pan out here in this country, that the Johnson & Johnson may have decreased effectiveness against the Delta variant, in which case a booster may be necessary. We just don't know at this time.
And it's important to note here, doctors say all of this is still preliminary. There's actually no official guidance about getting boosters in this scenario. So right now in North Carolina, you are not allowed to mix brands of shots like the doctor from Georgetown did. I called over to Forsyth County today where they had one of the biggest Johnson & Johnson clinics. They said they will not give you another brand like Pfizer too, because there's just not research yet to know what could happen to your body if they do. That means across North Carolina, more than 333,000 people who got the J&J shot will have to wait and see what the scientists end up recommending.
Well, you may have seen this headline from earlier this week. The World Health Organization recommended people still wear a mask even if they're fully vaccinated. Los Angeles County agrees. They're now asking people to wear masks in public spaces. CBS News medical contributor Dr. David Agus weighed in on these changes.
It's not a mandate, it's a recommendation, and I think it's a reasonable recommendation at the present time. You know, we have two Americas, those vaccinated and those not, and there are going to be different trajectories for both, and that certainly worries me.
Other experts disagree. We spoke about masks with Cone Health's Executive Medical Director of Pediatric Services, Dr. Michael Cinnamon.
In the United States, I think it's different than a lot of other parts of the world, and the World Health Organization is making statements that apply to Brazil and Europe and South America, all over the place. In the United, currently, the Center for Disease Control feels that if you are fully vaccinated 2 weeks after your second shot, that in most circumstances it's safe because of the data that I've already shared. The risk of getting seriously ill or being hospitalized or dying from COVID are approach zero. That it is safe.
So how do we stop the spread of the Delta variant, and how do we stop other new worse variants from forming? Experts say everyone across the world needs to get vaccinated as fast as possible.
As long as the countries in the world where there's lots of cases continue to have lots of cases, you have that fuel for new variants that are more dangerous to continue to emerge.
So the bottom line is this. Experts say if you are vaccinated, you are less likely to get really sick from this Delta variant.
You know, all along through coronavirus, we've given you the facts, not fear. You can count on that as more variants pop up.